Hi, I'm Stephanie Zawada. I'm a PhD student and engineer at Mayo Clinic, working on value-based applications of digital technologies. My team and I conducted research on our home hospital program and are sharing our findings regarding statutory reimbursement and community building strategies for high-value home hospital care in the United States. My co-authors are Dr. Nels Paulson, Dr. Margaret Paulson, Dr. Michael Manihachi, and Dr. Bart Demershock. Dr. Nels Paulson is a sociology professor at University of Wisconsin. Dr. Margaret Paulson is Director of Advanced Care at Home Research at Mayo Clinic Health System. Dr. Michael Maniaci runs our Advanced Care at Home Command Center in Florida. And Dr. Bart Demershock is Medical Director of Digital Health Research at Mayo Clinic. During the pandemic, lots of regulatory relief was introduced on a temporary basis to facilitate the delivery of care at home. For hospitals delivering inpatient level care to Medicare fee-for-service and non-managed Medicaid beneficiaries, the Centers for Medicare and Medicaid Services waive specific parts of the hospital conditions of participation, allowing 24/7 in on-site care to be delivered at home and with telehealth. Our specific application of the home hospital waiver allowed for the delivery of hybrid care at home, including in-person at-home visits and telehealth, which included video and audio-only visits, as well as remote patient monitoring. Our program increased access to care, enhanced the quality of care, drove down readmission costs, and personalized care for patients at home. However, reimbursement uncertainty, cybersecurity concerns, access to digital tools, and the transition from inpatient to outpatient level care remain challenges to hybrid care programs and their ability to demonstrate value to both public and private payers. Based on our interviews with staff and patients, we encourage policymakers to first update their definitions related to telehealth and, when appropriate, modify their hospital licensure laws to accommodate current and future technologies, as well as the 24/7 virtual presence made possible by such technologies. We also encourage policymakers to examine whether the home hospital waiver increased access to care for rural patients, given that few rural hospitals were recipients of the waiver during the public health emergency. We also encourage policymakers to make permanent or expand coverage for telehealth services associated with post-acute outpatient care that have demonstrated improved patient outcomes. And lastly, we want to encourage policymakers to avoid implementing cybersecurity requirements to allow individual institutions and staff to develop dynamic strategies that are inclusive of the digital comfort level and device availability of their underserved patients. And we encourage you to read our paper. Thank you.
My name is Nels Paulson. I'm a sociologist at University of Wisconsin Stout, and part of this paper, I want to respond to two questions posed to us. One is what is one thing you'd like people to know about this area? For hospital at home, I think it's a very exciting expansion of healthcare opportunities in the United States, especially because we have gaps in who gets high quality healthcare. It's exciting because it's a new venture for us to target patient populations who have been underserved. But it requires us to think ahead on how to serve those patient populations best and how to prioritize them. Otherwise, I think it's just going to go the way that all healthcare in the United States will, and that is to neglect patient populations who are people of color, poor, rural areas. And hospital at home is especially got this challenge for rural areas that Mayo Clinic is trying to take on directly. So my prediction for how this will progress is that if we don't overtly think about the unique challenges for patient populations in places like rural areas, then hospital at home isn't going to be able to deliver as well as it could at trying to fill these gaps in American healthcare. And I think that this is a really wonderful opportunity for us if we make sure that we are very cognizant on who's being served and who's not being served. Certainly the results so far on hospital at home programs in general and Mayo Clinic's advanced care at home specifically are very encouraging. And so I think we have a lot to look forward to.
Hello, my name is Dr. Margaret Paulson. I am a rural hospitalist and medical director for Mayo Clinic Health System's home hospital and home health programs in Northwest Wisconsin. What is one thing I'd like you all to know about home hospital? Well, home hospital is different than other existing home care programs. It's not home health, it's not remote patient monitoring, and it's not a transitional care program. Hospital at home cares for acutely ill patients meeting inpatient level criteria where they would otherwise be admitted to the traditional hospital. And acute care in the home takes a lot of coordination. So resource poor environments like rural America, where I reside, where we need to rely a lot on community partnerships, as well as tight coordination of our internal resources. So this requires a lot of innovation, automation, and emerging technologies, as well as a regulatory structure to allow the care to evolve. So this is really, I think, the only pathway forward to be able to efficiently and effectively serve our patients, as well as scale these services in the future. So what is my prediction as to how this area will progress, or what I'd like to see in the future? I think right now, hospital at home, this is only the tip of the iceberg for in-home care. But creating a construct to be able to pair in-home care and virtual care, that's going to allow us to care for patients in new ways like ED at home or rehab at home, and programs for super utilizers of healthcare resources. So I think the future is exciting, and I'm hopeful that our legislators and regulating bodies will also evolve to continue to meet the patient's needs and provide reimbursement structures to support these types of programs.